A very good morning, everybody. Today we will be dealing with another important topic, that is the palatine tonsils and the palate. The palatine tonsils comes as a short note, whereas in palate you have muscles of the soft palate that is asked, especially in your specimen. Okay. Now coming to the tonsil, we know that we have two tonsils, the palatine tonsils, which are commonly known as the tonsils. These are almond-shaped masses of lymphoid tissue that are present beneath the epithelium. They occupy the two sides of the oropharynx. They occupy a triangular area that is known as the tonsillar fossa that is present on the lateral side of the oropharynx. It is present between the anterior and the posterior pillar of fosses. The anterior pillar is formed by the palatoglossal arch, whereas the posterior pillar here is formed by the palatopharyngeal arch. When we look at it, the tonsils normally we see only a small part of the tonsil, whereas originally the tonsil is quite larger than what we see because a part of it is enclosed by the soft palate. Now, this triangular depression that is known as the triangular fossa, the tonsillar fossa, this triangular area that is the tonsillar fossa, is also known as the tonsillar sinus. When we look at the boundaries of this tonsillar fossa or the tonsillar sinus, we see that interiorly it is bounded by this fold that is the palatoglossal arch because it is running down from the palate to the tongue. So this is the palatoglossal arch that is formed by the palatoglossal muscle. The posterior arch we see here that goes up to the pharynx is known as the palatopharyngeal arch. The palatopharyngeal arch has the palatopharyngeus muscle. Okay, then we have apex. Apex is the soft palate where both the arches meet. Okay, this will be more clear in this diagram. Both arches meet at the apex of the tonsil, whereas the base is formed by the dorsal part of the posterior one-third of the tongue. Laterally, the lateral wall here, what will be the structures that are present laterally? They form the tonsillar bed. All of this will form the tonsillar bed. The tonsillar bed, when we look at it, is formed mainly from inside out. When we go, we see that the tonsillar bed is formed by the pharyngobasilar fascia, this one, then the superior constrictor muscle, and the buccopharyngeal fascia. Okay, so again, we say that the boundaries of the tonsillar fossa, anteriorly palatoglossal arch, posteriorly palatopharyngeal arch, apex is formed where the two arches meet, the base is formed by the posterior one-third of the tongue, whereas the lateral wall is formed by the structures that form the lateral wall, that form the tonsillar bed, that is formed by the pharyngobasilar fascia, the superior constrictor muscle, and the buccopharyngeal fascia. Now, when we look at the tonsil, we see what are the external features of tonsil. So, first we will look at this diagram. Obviously, there will be a surface that is facing medially, that is the medial surface. There is a surface that will be facing laterally, that will be the lateral surface. So, this is a diagram that is showing the medial surface, the lateral surface. Okay, this is a coronal section. Then here in the sagittal section, we can see this is the medial surface you see here. The lateral surface is not seen here. Then we have this border that will be the anterior border. Then this border will be the posterior border. We have an upper pole and a lower pole because it is like an almond. Okay? So चारों तरफ से एक surface medial, एक surface lateral, एक upper pole, lower pole, anterior surface, anterior border and posterior border. Is it clear? Now, first let's talk about this surface. This is the medial surface. When we look at the medial surface, as we can see here, this medial surface, it is free and it bulges into the oropharynx. Obviously, whole of it will be covered by epithelium. The epithelium will be the same as that covers the rest of the oral cavity. We know we have discussed in histology practical the different lymphoid tissue, and one of the distinguishing feature of the tonsils is that it is lined by non-keratinized stratified squamous epithelium. Okay, so this surface will be lined by non-keratinized stratified squamous epithelium. When we look at this surface dips inside the substance of this lymphoid tissue and it forms small crypts. In tonsil, normally we have about 10 to 15 crypts. The openings can be seen. Okay. Now, one of the crypts that is present on the upper pole is large and quite deep, and this is known as the crypta magna or the intratonsillar cleft. This represents the remnant of the second pharyngeal pouch. During an infection, these crypts may be filled with cheesy material, or normally they can be filled with food debris and epithelial cells. Okay, then the lateral surface here. When we look at the lateral surface, we see that it is covered by a well-defined fibrous tissue. This forms a hemisphere. It forms half a capsule of the tonsil. Okay, between this area that lies between the bed of the tonsil and the capsule. This was the bed of the tonsillar bed formed by these three structures, and the capsule. We have this space, and this space is filled with loose areolar tissue. This space is known as the peritonsillar space. ठीक है, peritonsillar, tonsil के साथ की space is a peritonsillar space. Now, the importance of this peritonsillar space is that it is easy to dissect out the tonsil. को हम यहाँ से incision देके निकाल सकते हैं. So during tonsillectomy, that is removal of the tonsil, this peritonsillar space provides a cleavage site जहाँ से हम लोग काट के tonsil को निकाल सकते हैं. ठीक है? इसके अलावा there may be infection as well. Infection may also develop in this peritonsillar space and may cause a peritonsillar abscess. Is it clear? Okay. Then hair. When we see this, the tonsillar bed hair, okay, so this superior constrictor muscle hair separates this tonsil from few structures. What are these structures? We have the facial artery and two of its branches, that is the ascending palatine and the tonsillar branch. We have the styloglossus muscle and the glossopharyngeal nerve. We have the styloid process. Okay, then we have the gland, that is the submandibular gland. We have the angle of mandible and the medial pterygoid muscle. So this is an important diagram. It is showing all the relations of the tonsil. You can make this diagram in exam. You can make this diagram in exam. Okay. So this was about the lateral wall. So again, we said that we had a medial surface, a lateral surface. We have this anterior border, posterior border. We have an upper pole and a lower pole. See, we talked about this medial surface. As we can see here, I said that the medial surface here is lined by stratified, non-keratinized stratified squamous epithelium. There are dips that are seen. These dips form the crypts. There are about 12 to 15 crypts. The openings can be seen, as you can see in this diagram. One of the crypts that is present on the upper pole is large. That shows that it's a remnant of the second pharyngeal pouch. This is known as the crypta magna or the intratonsillar cleft. Okay. Then we talked about the lateral surface. We said that the lateral surface was covered by a fibrous capsule that was forming a hemicapsule. This fibrous capsule was separated from the lateral structures of the tonsil, that is the structures that are forming the tonsillar bed. That was the pharyngio-basilar fascia, the superior constrictor, and the buccopharyngeal fascia. It was separated by this space that is known as the peritonsillar space. The peritonsillar space is filled with a loose areolar tissue. It acts as a line of cleavage during tonsillectomy, and sometimes infection can spread here. That is known as the peritonsillar abscess. Then we said that this superior constrictor muscle or the tonsillar bed separates the tonsil from some important structures, which are one artery, one gland, one muscle, one nerve. See? So the artery, facial artery, two of its important branches. If you don't remember the name of the branches, you can remember facial artery. What are the two branches? The ascending palatine and the tonsillar branch. Okay. Then one muscle and the styloglossus and the glossopharyngeal nerve, one gland, that is the submandibular gland, the angle of mandible, and the medial pterygoid muscle. Is it clear? Okay. Then talking about this anterior border. This was the anterior border, this was the posterior border. So the anterior border lies underneath this arch, that is the palatoglossal arch, whereas the posterior border is lying just beneath the palatopharyngeal arch. This upper pole here, this is the upper pole, right? This is the hard palate, the soft palate. So the upper pole of the tonsil. So it extends into the soft palate. As you can see, this is the soft palate. The upper pole extends into the soft palate. Its medial part, the medial surface of the upper pole, is covered by a semilunar fold. There is a fold of mucous membrane that is extending anterior or posterior arches जो हैं या folds जो हैं इनके बीच में there is a fold that is covering the apex. इस फोल्ड की वजह से एक स्पेस बनती है यहाँ पे, और इस स्पेस को हम बोलते हैं सुप्रा टॉन्सिलर फॉसा. वैसे समझो यहाँ एक पर्दे जैसा है जिसके नीचे से एक स्पेस बन गई जिसको हम लोग सुप्रा टॉन्सिलर फॉसा बोलते हैं. इज इट क्लियर? देन this was the lower pole here. The lower pole is attached to the tongue by a band of fibrous tissue that is known as the suspensory ligament of tonsil. ठीक है, यही डायग्राम्स आप लोगों को बनानी. ओके, इसके बाद if we see here, the tonsil is separated from the tongue by a sulcus यहाँ पे, and this sulcus जो उसको separate करता है इसको हम लोग बोलते हैं tonsillolingual sulcus. ठीक. Talking about the arterial supply of tonsil, easy है, कुछ नहीं, इसी डायग्राम में सारा कवर हो जाता है. ठीक है, सबसे पहले we have the tonsillar branch of the facial artery. So this is your facial artery. It has a tonsillar branch. The tonsillar branch of facial artery की है, this is the principal artery that is supplying the tonsil, or it enters it from the lower pole of the tonsil. Then we have dorsal lingual arteries that are branches from the lingual arteries. Then we have ascending palatine artery that is a branch of the facial artery again. Then we have ascending pharyngeal artery that is a branch of the external carotid artery. And we have the greater palatine artery. Okay, so the main arterial supply of the tonsil is via the tonsillar artery branch of the facial artery. फेशियल आर्टरी की एक और ब्रांच ascending palatine भी इसको सप्लाई करती है. लिंगुअल आर्टरी की dorsal lingual artery सप्लाई करती है. इज इट क्लियर? ascending pharyngeal artery सप्लाई करती है, ascending palatine artery सप्लाई करती है. When we talk about the venous drainage, जब venous drainage देखते हैं हम लोग तो हम देखते हैं कि the vein जो tonsils की vein है that drains mainly in this vein. ठीक है, so the veins from the tonsil drain into the paratonsillar vein. Okay? The paratonsillar vein, when we see here, it descends from the soft palate, पूरा tonsil के paratonsillar space में run करती है. ठीक है? Then it will pierce the superior constrictor muscle, and ultimately it goes and drains into this pharyngeal venous plexus. So the venous drainage is by this paratonsillar vein, which has its importance during surgery of tonsils, which ultimately pierces this superior constrictor and drains into the pharyngeal venous plexus. Okay. The lymphatic drainage from the tonsil. The lymphatics from the tonsil pierce the superior constrictor muscles and drains into the deep cervical lymph nodes, particularly the jugulodigastric lymph nodes. So obviously if there सीधी सी बात है जहां का भी venous drainage जिस तरह के lymph nodes में जाता है तो वो lymph nodes enlarge हो जाते हैं जब उस जगह की infection होगी. So obviously ये जुगलो-डायगैस्ट्रिक lymph node जहां पे primarily हमारा lymphatic drainage tonsil का जा रहा है, they're also known as the tonsillar lymph. ठीक है? Why? Because these are enlarged in infection of tonsil, that is tonsillitis. The tonsillar lymph nodes are located below the angle of mandible. Then we have the nerve supply of tonsil. The nerve supply of tonsil is via the glossopharyngeal nerve and the lesser palatine branches of the sphenopalatine ganglia. Coming to some of the clinical importance of tonsil, acute tonsillitis. Tonsils are frequent sites of infection, especially school-going children में देखा जाता है. इस condition को क्या बोलते हैं? इसको acute tonsillitis कहते हैं. ठीक है? There may be acute follicular tonsillitis. इसमें क्या हो जाता है? Infection crypts में. This is the medial surface. These are enlarged tonsils, right? This is the uvula. So I told you that on the medial surface we have crypts, and these crypts can be filled with cheesy material or infective substance, right? So when these crypts are filled with purulent substance and they block the opening of these crypts, producing a yellowish structure here, yellowish हम लोगों को दिखता है spots here. This is known as acute follicular tonsillitis. Acute follicular tonsillitis. Okay. Then there is another condition that is bleeding. Bleeding from the tonsillar fossa, tonsillectomy के बाद, as we have seen here, the tonsillar fossa was this part, right? यहाँ पे. So, अब ये जो paratonsillar vein है, because this was the site of cleavage जिस पे हम लोग incision दे रहे थे. So most commonly damage अगर इस paratonsillar vein पे हो जाएगा, there will be bleeding in this tonsillar fossa. ठीक है? So the blood clot should be removed in order to check bleeding. If not removed, they will interfere with the retraction of vessel wall by preventing the contraction of surrounding muscles don't contract, जिसकी वजह से bleeding ज़्यादा बढ़ सकती है. ठीक है? ये आप लोग ज़्यादा अच्छे से ENT में पढ़ोगे. So this finishes your tonsil, जो short note आता है. ठीक है? इसके बाद important structure है, that is the palate. So obviously, we know that palate forms the roof of the mouth. It is a partition between the nasal and the oral cavity. We also know that we divide the palate into hard palate and soft palate. Hard palate is the part that is the interior 4/5 of the palate, whereas the posterior part is formed by the soft palate. Exactly. Hard palate, the boundaries, the sutures have been discussed in norma basalis. Here be just mota. We see here, what are these two plates here? We have the palatine processes of the maxilla. We have these two structures here. These are formed by the palatine bone, right? So these are the horizontal plates of the palatine bone. We have this cruciate suture, intermaxillary, interpalatine, and palatomaxillary suture, right? This was a cruciate suture. Then we saw here, we had the incisive fossa here. On the posterior part, we had the greater palatine foramen. Then on this pyramidal process, we had the lesser palatine foramen. Posteriorly, we had a projection posteriorly that was known as the posterior nasal spine. Just behind, in front of it, we had the attachment of the palatine epineurosis. So, I don't want to go into detail of this. आप लोग नॉर्मा बेसालिस वाला लेक्चर देखिएगा, उसमें ये क्लियर हो जाएगा. ठीक है? ओके. पैलेटाइन क्रेस्ट क्या है वगैरह वो सब आप उसमें देख लेंगे. Now, coming to the arterial supply of the hard palate is, as you can see here, the arterial supply is by the greater palatine artery. Okay. The venous drainage is mainly into the pterygoid venous plexus. The nerve supply, we can see here, we have the hard palate is supplied by the greater palatine nerve, obviously जो यहाँ से जा रही थी, and it was going into the incisive fossa, and we have the nasopalatine nerve. These are derived from the pterygopalatine ganglia. ठीक है? फिर the greater palatine nerve जो है, this one, the greater palatine nerve supplies whole of the palate except the anterior part of the palate that lies behind the incisor teeth, that is supplied by the nasopalatine. So ये आपको याद रखना है, this part develops from a totally different part. So the nerve supplies the nasopalatine nerve, the incisors के पीछे, बाकी is via the greater palatine nerve. So this is showing this greater palatine, nasopalatine, and the part of the parametric process is by the nasopalatine nerve. The lymphatics from the palate drain mostly into the upper deep cervical lymph nodes, and some may go into the retropharyngeal lymph nodes as well. Okay, now coming to the important question, that is the soft palate. Now, as you can see, this soft palate, what is it? It is a mobile muscular flap. It hangs down from where? From the posterior part of the hard palate into the pharyngeal cavity like a curtain. इसका काम क्या होता है कि जो curtain है that is hanging down from the hard palate, it acts to separate the nasopharynx from the oropharynx. ठीक है, क्योंकि हम लोगों ने जब बाउंड्रीज पढ़ी थी तो हमने कहा था नेजो सॉफ्ट पैलेट के इस बॉर्डर तक और फेरेंजियल एस्टमस तक जो ओपनिंग है वहां तक हमारा नेजोफैरिंक्स होता था, उसके नीचे हमारा ओरोफैरिंक्स है. ठीक है, so this mobile flap that is hanging down from the hard palate, from the posterior border of the hard palate, and it's acting like a curtain in the oropharynx, separating the naso and the oropharynx, is known as a soft palate. Okay. Now, अब इस सेक्शन पे हम देखेंगे what are the external features of this. So ये surface होगी. ये surface क्या है? This is the anterior surface. This is the posterior surface, right? This is the superior border जो attach होगा. This will be the inferior border. In this diagram, when we see this surface which we see here is the anterior surface. It is concave and it is marked by a median raphe. ठीक, posterior surface, it is convex and is continuous with the floor of this cavity, that is the nasal cavity. This is the posterior surface. The superior border here, it is attached to the posterior part of the hard palate, और ये inferior border है, inferior border free. ठीक है, ये free है और ये pharyngeal isthmus का interior boundary बनाता है. ठीक है, अभी जब हम देखेंगे तो we see जो inferior border, the free inferior border has a small tongue-like projection that hangs downwards, that is known as the uvula. ठीक, उसके अलावा दोबारा ये चीज अब हम लोगों ने इतनी बार पढ़ी that from the base of uvula we see two folds, जो tonsillar fossa के दो folds बनते हैं. ठीक है, ये oropharyngeal isthmus के folds बनते हैं. What are these? Anterior fold नीचे जाके टंग के साथ जाएगा तो palatoglossal arch, इसमें palatoglossal muscle होगा. ठीक है, posterior वाला जो है वो palatopharyngeal arch बनाएगा, इसमें palatopharyngeal muscle होगा. ये हो गया, ये आप लोगों को बता चुके हैं. ठीक है, now अब ये जो है soft palate, ये बनता किस तरह है? So अगर तुम देखोगे यहाँ से भी mucous membrane होगी, obviously यहाँ से भी mucous membrane. ठीक है, so basically it is a fold of mucous membrane and between this fold we have few muscles that are present. We have 5 pair of muscles that is present. ठीक है, यहाँ का जो mucous membrane है उसमें epithelium कौन सा लाई करेगा? सुपीरियर सरफेस पे जो nasal cavity का होगा. Nasal cavity में कैसा epithelium होगा? Pseudo stratified ciliated columnar है. ओरल कैविटी में कैसा होगा? जो बाकी टॉन्सिल्स पे भी देखा, दैट इज नॉन केराटिनाइज्ड स्ट्रैटिफाइड स्क्वैमस एपिथेलियम. देखो बच्चों, एपिथेलियम कहाँ का कैसा है ये आप लोगों को पता होना चाहिए, उसके फंक्शन के हिसाब से एपिथेलियम होता है. फॉर एग्जांपल अगर नेजल कैविटी में देखोगे, नेजल कैविटी में क्या करना है? आपको पार्टिकल्स को रोकना है तो वहां पे क्या होना चाहिए? सीलिएशन होनी चाहिए. ठीक है ना, तो स्यूडो स्ट्रैटिफाइड सीलिएटेड कोलम्ना. यहाँ पे कैसा होगा? यहाँ पे वेयर एंड टियर खाने की वजह से काफी होगा. ठीक है, सो नॉन केराटिनाइज्ड स्ट्रैटिफाइड होना चाहिए, स्क्वैमस एपिथेलियम होगा. ठीक है, ओके. इसके अलावा इसमें जो सबम्यूकोजा होता है हिस्टोलॉजी में देखोगे उसमें बहुत ज्यादा ग्लैंड्स, पैलेटाइन ग्लैंड्स भी प्रेजेंट होते हैं. ठीक, ओके. सो इसने अपने हिसाब से थोड़ी डायग्राम दिखाई है. ये पैलेटाइन ग्लैंड्स दिखाए हैं, वो भी प्रेजेंट होते हैं सॉफ्ट पैलेट में भी, हार्ड पैलेट में, ठीक है। नाउ कमिंग टू द मसल्स, सो जो स्पेसिमेन रखा जाता है उसमें मार्क करके रखा होता है, सॉफ्ट पैलेट पे पिन रखी होगी, फिर आपसे क्वेश्चन यही पूछेंगे व्हाट आर द मसल्स है। सो व्हाट आर द मसल्स ऑफ द सॉफ्ट पैलेट? वी हैव मसल्स, दीज आर द टेंसर विलाई पैलेटाइन मसल, ये we are looking at the palate from back. What are you seeing here? ये nasal cavity है, ठीक है, ये आपका soft palate है, ठीक है, and a part of pharynx है यहाँ पे. So ये eustachian tube है. So we have tensor villi palatine muscle. We have the levator villi palatine muscle. Then we have the palatopharyngeus muscle. We have the palatoglossus muscle, and we have this muscle that is the musculus uvula. All of these muscles, except the musculus uvula, are extrinsics. This is an intrinsic muscle. Now, first of all, let's talk about the tensor palatine muscle. So, the tensor villi palatine muscle है this one. पीछे वाला जो है, this is the tensor villi palatine muscle. When we look at this, it arises from ये जो blue color का है, this is the cartilaginous part of the auditory tube. Okay, so it arises from the lateral aspect of the cartilaginous part of the auditory tube, and at the same time, it also arises from the greater wing of the sphenoid, including the spine of sphenoid. It is also present in the scaphoid fossa on the medial pterygoid plate. ठीक है, स्केफॉइड फोसा में मैंने आप लोगों को बताया था टेंसर विलाई पैलेटाइन मसल, ठीक. सो अराइजेस फ्रॉम द लेटरल एस्पेक्ट ऑफ द कार्टिलेजिनस पार्ट ऑफ द eustachian tube, arising from the greater wing of the sphenoid, the spine of the sphenoid, and the scaphoid fossa. When we look at this muscle, ये आगे जाता है और pterygoid hamulus जो होता है उसके अराउंड ये हुक करता है, ठीक है, ये हुक जैसा करता है और फिर जाके लगता है in the palatine epineurosis. Is it clear? So it hooks around the pterygoid hamulus and is inserted into the palatine epineurosis. As we know, the palatine epineurosis is attached to the posterior border of the hard palate behind the palatine crest. Okay? So origin यहाँ से pterygoid hamulus को change करके palatine epineurosis. इसका काम क्या है? It tightens the soft palate. At the same time, it is attached to the auditory tube, so it helps in opening of the auditory tube as well. Coming to this muscle, this one here, this is the levator villi palatine. Levator villi palatine. This was tensor villi palatine. Tensor villi tense करेगा palate को. Levator villi elevate करेगा palate को. वहीं से समझ आता है. So the levator villi palatine, ये कहाँ से आता है? ये मीडियल पार्ट ऑफ eustachian tube से आता है, वो टेंसर लेटरल पार्ट से आ रहा है. सो levator villi मीडियल पार्ट ऑफ द cartilaginous part of auditory tube से आता है, and it also arises from part of the petrous part of temporal bone. ठीक है, petrous part of temporal bone, नॉर्मा वजालिस पढ़िएगा मेहरबानी करके अच्छे से. petrous part of temporal bone से भी आता है, ये भी आगे जाता है, स्प्रेड आउट करता है और palatine epineurosis में लगता है, ठीक है. सो टेंसर वाला लेटरली लेटरल पार्ट से और लेवेटर विलाई जो है वो मीडियल पार्ट से है. इज इट क्लियर? इसके बाद जैसे मैंने बोला टेंसर वाला जो है वो क्या करेगा? वो सॉफ्ट पैलेट को टेंस करेगा, व्हेयरएज लेवेटर विलाई वाला जो है वो क्या करेगा? इसका काम होगा सॉफ्ट पैलेट को एलिवेट करना. जब सॉफ्ट पैलेट हमारा एलिवेट होगा तो क्या काम होगा? जब सॉफ्ट पैलेट एलिवेट होगा तो ये pharyngeal isthmus has to be closed. So it elevates the soft palate to close the pharyngeal isthmus, and at the same time, it also helps in opening the auditory tube. So because these two muscles, levator villi and tensor villi, are attached to the auditory tube as well, so they help in opening the auditory tube as well. ठीक है, ये दिखाया इसने levator villi palatine. Then we have the musculus uvula muscle. The musculus uvula muscle arises from the posterior nasal spine and the palatine epineurosis. ये कहाँ जाता है? ये फ्री मसल है, ये म्यूकस मेम्ब्रेन ऑफ द पैलेट में लगता है. इसका काम क्या होता है? ये यूविला को खींचता है फॉरवर्ड ऑन इट्स टू one side. ठीक है? Then we have important muscle, that is this. This is the palatoglossus muscle. So the palatoglossus muscle arises from the palatine epineurosis से origin करता है और कहाँ जाता है? It is inserted on the side of the tongue at the junction of the oral and the pharyngeal part. देखो ये जो मसल्स थे दो लेवेटर विलाई और टेंसर विलाई वो पैलेटाइन एपिनेरोसिस में इंसर्ट करते हैं और पैलेटोग्लॉसस मसल जो है ये ओरिजिनेट करता है वहां से और कहाँ जाएगा? ग्लॉसस में जाएगा, टंग में जाएगा, लेटरल सरफेस ऑफ टंग पे जाके लगता है। अब इसका काम क्या होगा? क्योंकि टंग में लग रहा है, इट पुल्स द रूट ऑफ द टंग। जब ये रूट ऑफ द टंग को पुल करेगा, इट विल हेल्प to approximate the palatoglossal arches and close the oropharyngeal isthmus. So there was one muscle that was closing the pharyngeal isthmus. That was the levator palatine muscle. And there is another muscle that is closing the oropharyngeal isthmus. That is the palatoglossus muscle. Is it clear? Then we have this muscle that is the palatopharyngeus muscle. ठीक? The palatopharyngeus muscle के दो fasciculi and दो parts होते हैं. Anterior fasciculi arises from the hard palate, head, and the posterior fasciculi जो है वो आता है palatine epineurosis. ये descend करता है कहाँ पे? ये pharynx के साथ merge करता है. ठीक है? तो ये insert होता है दो जगह पे. एक जाता है median fibrous raphe of the pharynx में और एक जाता है posterior border of the lamina of thyroid cartilage. ये आपको याद करने मैं इनको कुछ नहीं कर सकती. ठीक है? इसका काम क्या होगा? It will raise the pharynx and the larynx during swallowing. ठीक? So this is the palatopharyngeus muscle. So this is another diagram that is showing the eustachian tube here. ठीक है? यहाँ पे हम देख रहे हैं. ठीक, ये हमारा यूविला, ये इसमें पैलेटोफेरेंजियस मसल दिखाया है, ये लेवेटर विलाई पैलेटाई दिखाया है और हमारा टेंसर विलाई पैलेटाई यहाँ. ठीक है? Now, what are the functions of soft palate? Obviously, soft palate separate करता है oropharynx and nasopharynx को during swallowing, so food doesn't enter the nose. It isolates the oral cavity from oropharynx during chewing so that breathing is not affected. It helps to modify the quality of voice. It protects the damage of nasal mucosa during sneezing by approximately dividing and directing the blast of air through both nasal and oral cavities. And it prevents the entry of sputum into the nose during coughing by directing it into the oral cavity. Basically, एक गेटवे की तरह, एक उसको कर्टन की तरह बंद करता है. ठीक, now यहाँ पे देखो, this is a diagram that is showing paralysis of the soft palate. The soft palate, ठीक है, is damaged. The soft palate में paralysis हो जाती है if the vagus nerve is damaged. ठीक है, हम बंदे को बोलते हैं open up your mouth, आ करो. We see that what happens. हम लोगों को क्या चीजें दिखती है? पहले तो सबसे पहले symptoms क्या होते हैं? आपके पास पेशेंट आता है किसके साथ? There is a nasal regurgitation of liquids. वो पानी पीता है, नाक से पानी वापस आता है. ठीक है? दूसरा, there is a nasal twang in voice. हम नॉर्मली जब बात करते हैं, what is nasal twang? क्या होता है? जैसे जब जुकाम के दौरान जैसी आवाज आती है ना, नाक जैसे लग रहा है नाक से बात कर रहे हो, तो nasal twang in voice होता है. ठीक है? इसके बाद जब हम इसको बोलते हैं आप मुंह खोल के आ करो, तो हम देखते हैं कि there is flattening of the palate arch on one side. On the side of lesion, palate का arch एकदम flatten हो जाता है. ठीक है? And the uvula is pushed to the opposite side. So यहाँ पे हम लोग देख सकते हैं, यहाँ तो arch सही है, but यहाँ पे flattening of arch है, and uvula is not centrally placed, but it is pushed to the opposite side. That means the vagus nerve of this side is paralyzed. Coming to the arterial supply is via the lesser palatine branch of the maxillary artery, the ascending palatine branch, and the palatine branch of the ascending pharyngeal artery. The venous drainage is in the pharyngeal venous plexus that was present on the middle constrictor and into the pterygoid venous plexus. Similarly, the lymphatic drainage goes into the retropharyngeal lymph nodes and upper deep cervical lymph nodes. Now, another important question, दोबारा वही चीज मैं आपको बोल रही हूँ कि ऐसे आपसे पूछते हैं, all of these supply by this except this which is supplied by this, ठीक है? So, all the muscles of soft palate are supplied by the cranial root of accessory nerve via the pharyngeal plexus. We have seen in the last lecture pharyngeal plexus banta kaise, right? So it is supplied by the cranial root of accessory via the pharyngeal plexus, except tensor villi palatine muscle. The tensor villi palatine is supplied by the nerve to the medial pterygoid muscle, which is a branch of the mandibular nerve. Very important viva question. All the muscles are supplied by cranial root of accessory via the pharyngeal plexus, except the tensor villi palatine, which is supplied by the nerve to the medial pterygoid, which is a branch of mandibular nerve. This was the motor supply. What about the sensory supply? So here we have general sensation, pain, touch, temperature की जो sensation होती है. इसके अलावा palate में glands हैं, so उसमें taste sensation भी होती है, ठीक है? So sensory supply में general sensation जो है that are carried by the lesser palatine nerve to the maxillary division of trigeminal nerve via the pterygopalatine ganglion and the glossopharyngeal nerve. तो वो अगर याद नहीं रहेगा, lesser palatine nerve और glossopharyngeal nerve general sensory fibers हमारे पास लेके जाती है. दूसरी होती है gustatory nerve. What is gustatory nerve? Gustatory nerve is taste. Soft palate से taste भी जाना होता है, ठीक है? अब ये जो taste है from soft palate ये कैसे जाता है? So the taste from the soft palate passes via the lesser palatine nerve, ठीक? Lesser palatine nerve के through क्या करती है? It goes into the pterygopalatine ganglion here, ठीक? Pterygopalatine ganglion के बाद ये यहाँ रिले नहीं करती, किसी और में जाती नहीं है, अपने फाइबर्स लेके जाती है. इस pterygopalatine ganglion में फाइबर्स नहीं देती है, ठीक है? यहाँ से जाती है nerve to pterygoid canal. Nerve to pterygoid canal से जाता है greater petrosal nerve. Greater petrosal nerve से ये जाता है geniculate ganglion of facial nerve. फिर जाता है nervus intermedius के थ्रू हमारे पास nucleus of tractus solitarius. So these are the gustatory fibers. Gustatory fibers कैसे पास करते हैं? Is it clear? ठीक? So lesser palatine nerve से gustatory fibers जाते हैं, यानी taste sensation जो जा रही है वो lesser palatine nerve के थ्रू जा रही है. फिर हमारे पास pterygopalatine ganglion के थ्रू जाएगी without a relay. The important thing, it doesn't relay here. फिर nerve to pterygoid canal, फिर greater petrosal nerve, geniculate ganglion, nervus intermedius, and goes to the हमारा NTS nucleus of tractus solitarius. ठीक? ये taste लेके जा रहा है. इसके बाद हमारे पास gustatory fibers भी आने हैं. Gustatory fibers क्या है? Sorry, secretomotor fibers. Secretion भी तो करनी है. Glands हैं, glands में secretion होनी है. So the secretion जो लेकर आता है, it comes through the superior salivatory nucleus. Facial nerve का superior salivatory nucleus, the nervus intermedius, then the geniculate ganglion, the greater petrosal nerve, then the deep petrosal nerve के साथ ही जुड़ती है, ठीक है? pterygopalatine ganglion में जाता है, वहां से lesser palatine nerve के थ्रू glands of soft palate में जाता है, ठीक है? Okay. Then gag reflex. So very important reflex is gag reflex. ये क्या होता है? It's a protective reflex. आप जबान को बहुत दबा के रखो या आप soft palate को touch करो तो ऐसी feeling होती है इससे उल्टी आएगी, right? So it's a protective reflex mechanism that is characterized by elevation of the heart of the palate, ठीक है? And contraction of the pharyngeal muscles. It is associated with retching and gagging in response to stimulation of mucous membrane of the oropharynx. Oropharynx को touch करो, वाली feeling जो आती है उसको gag reflex कहते हैं, ठीक है? क्यों होता है? It occurs when the palate, the tonsil, the posterior part of the tongue or posterior pharyngeal wall are touched by some object like swab या spatula. ठीक है? आजकल आप लोग सब कोविड का टेस्ट कर रहे हैं, उसमें भी ये फीलिंग आती है, ठीक है? The afferent limb जो लेके जाती है of the reflex is via the glossopharyngeal nerve क्योंकि वो sensory nerve है, और efferent limb जो gag reflex cause कर रहा है that is via the vagus nerve. So this finishes your soft palate. Palate की development भी बहुत important है. और जो कंजेनाइटल एनोमलीज जो हमारे पास क्लेफ्ट पैलेट है वो भी इंपॉर्टेंट है, वो आप लोगों को एम्ब्रियोलॉजी में कवर हो गया होगा।